And how do you treat headaches? There is any specific approach do you use, or how does it work?
Well, it depends. It depends on my findings in the objective, okay, and it depends on my findings in the subjective. Because if I have someone that is really afraid of me and he's scared and he doesn't want to be touched or anything, so I maybe have to use everything I have with hands off, okay. And I like to start with everyone, with knees, with elbows, with everything. I like to start with hands off. Why? Because I don't know the person yet, okay? And I don't know the problem that the person is suffering from. So I don't know if it's irritability is high and I do something that is too much for him. I think it's soft, but for him it's too much. And then I get the patient much, much worse, okay? And I say, okay, so I start with the lowest force I can, which is usually the patient-generated force. And then I try to push more according to the response. If the patient is not getting any worse and is not getting any better, okay, maybe you need a little bit more, okay? So it's going little by little. I'm increasing, building up my pushing. But I try to start with my hands on. And I'm quite confident, not because of me, but I think the physiotherapy. I think with physiotherapy, we have a lot of hands-off approaches. And I don't like to talk about names. I mean about techniques, okay, or movements that help us to change quickly the range of motion and to know if they are related to pain. So yes, mainly I start always, it doesn't matter if you're telling me that, okay, when you touch my muscle, it's giving me headaches. Okay, it's okay, no problem. But still, I'm going to see if I'm able to change things only with the movement, with the hands off. And of course, if it's indicated, because I'm not getting any response, I try to do something else with my hands, of course.